Head circumference is the outer perimeter of the skull. It is measured using the ellipse facility of ultrasound equipment at the same level as biparietal diameter. Using the ellipse facility, place the line of the ellipse on the outer border of the skull to obtain head circumference. Head circumference is less affected than biparietal diameter by head shape variations and the presentation of the fetus. So head circumference is preferred as a more valuable measurement in assessing gestational age. Femur length. All the fetal long bones can be adequately examined and measured by ultrasound. However, the femur is the largest of the long bones, least movable, and easiest to image. This measurement is as accurate as the biparietal diameter in the prediction of gestational age. It is useful in confirming the gestational age estimated from biparietal diameter or head circumference measurements. It can often be obtained when fetal position prevents measurement of the diameter or head circumference. Measurement of femur length should not replace that of biparietal diameter or head circumference as the sole predictor of gestational age. The femur can be measured from 12 weeks to term. It has been identified that the accuracy of femur length in the predictions of gestational age is 2.8 weeks. With increasing gestational age, the accuracy of femur length decreases. How to measure femur length. Obtain longitudinal view of the femur closest to the probe. The end points of the femur are easy to define when the femur lies at a slight angle, 5 to 15 degrees to the horizontal. The full length of the bone is visualized. The bone should not be obscured by shadowing from adjacent bony parts. Magnify the image. The cross-section of the femur should fill at least 30% of the monitor. The intersection of the calipers is placed on the outer borders of the edges of the femur bone, outer to outer. The trochanter should not be measured. In the second trimester, only the ossified diaphysis of the femur can be demonstrated. In the third trimester, the greater trochanter and distal ossification center can be seen, and this allows one to orientate the section plane better. The greater trochanter should be avoided in measuring the femur length, as this results in an incorrect excessive measurement. This is an example of incorrect measurement of femur length. As you can see, the two edges of the femur are not clear. The main reason for this is poor magnification, leading to incorrect estimation of femur length. Another example here of incorrect estimation of femur length. As you can see, the femur is in oblique position. In addition, the magnification is also poor, leading to unclear visualization of the bony ends and subsequent incorrect measurement. You should remember that the greater trochanter should be avoided in measuring the femur length, as this results in an overestimation of the femur length and subsequent gestational age. So, remember that the femur can be easily recognized between 14 weeks and term gestation. The femur should be horizontal as possible. Measure the bone closest to the probe. See the full length of the bone. The bone should not be obscured by shadows. Magnification is important. Correct caliper placement is essential. And lastly, do not include greater trochanter in measurement. Abdominal circumference. Abdominal circumference should not be used at all to determine gestational age. However, it is one of the key dimensions to assess intrauterine growth restriction and fetal macrosomia. It is measured by the ellipse facility of ultrasound equipment, with the stomach bubble and a short segment of the umbilical vein at the level of the portal sinus are visible. How to measure abdominal circumference. Obtain a transverse section of the fetal abdomen, as close as possible to circular. The umbilical vein should be in its anterior third. The stomach bubble should be visible. The kidneys and bladder should not be visible. The fetal spine are best positioned at 3 or 9 o'clock. Magnify so that the cross-section of the fetal abdomen should fill at least 30% of the monitor screen. Ensure not to distort the circular shape of the fetal abdomen by applying too much pressure with the transducer. Using the ellipse facility, place the line of the ellipse on the outer border of the abdominal skin. This is an example of correct measurement of abdominal circumference. The image is well magnified. The section is circular. The landmarks are seen. Short segment of umbilical vein in the anterior third. Stomach bubble is visible. Spine at 3 o'clock. The bladder, kidneys and heart are not visible. And the ellipse calipers are well placed on the outer skin surface. This is an example of incorrect measurement of abdominal circumference. As you can see here, the entire intra-abdominal umbilical vein is demonstrated. This means that the plane is too angled, leading to incorrect estimation of abdominal circumference. Another example here. The umbilical vein is not in the anterior third. Also not a short segment. Like in the previous example, the plane is too angled. Also, the stomach is not clearly visible. So, this is incorrect image to measure abdominal circumference. Last case. As you can see, the magnification is very poor. The umbilical vein may be correct, but is not visible as the image is too small. So, this is incorrect image to obtain abdominal circumference. So, to remember, in abdominal circumference measurement, obtain section as circular as possible. Short umbilical vein in anterior third. Stomach bubble should be seen. Kidneys, bladder and heart should not be visible. Magnification is important. And correct caliper placement is essential.